Hi guys, welcome to this video on acute or admission cases in the CSA exam. Why a video on this? Two reasons. Number one, it's been asked for quite a few times by some of you guys, both by email and on our courses. And secondly, it's a completely different mindset to when you deal with your normal run-of-the-mill, non-acute, non-admission type cases. There's different things to think about. This video is about giving you confidence in dealing with those situations and a few key tips to make them work successfully for you, particularly in terms of the second half when there's a lot of things to get through. I'm Aman, I'm a GP and educator. Hopefully you'll find this video useful. Let's get started. So one of the first things that I can advise is look for those subtle early cues that this might be or is likely to be an admission case going forward. For example, things that you see, someone comes in holding their tummy, someone comes in holding their chest, someone comes in desperately short of breath. This should set alarm bells off that this is an acute case here and I'm going to have to move pretty quickly in the first half, so I have time to deal with these things going on in the second half. It could be things that patients say, doctor, I hardly come to the doctor, but I had to come, I couldn't ignore this. Or doctor, it's been so bad recently, I just had to come and see you. Subtle things like this, again, should get your mind working and thinking a little bit more acute frame of mind. It could be things that you've noted in the patient's note. Someone who's quite young, someone who hasn't come for 4 or 5 years, who suddenly presents to you today. Obviously they're not someone who comes to see you very often, so it could be that something is bad enough that it could be worth thinking about an admission going forward. So make sure you look for those subtle cues early on in the case. They will be there and they should get your mindset changing and thinking acute, 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 which will make you move quicker in the first half, giving you that time to work things and move things properly in the second half. So be sharp early on and make sure you're alert to those cues. So secondly, whilst we're in data gathering, don't forget the importance of psychosocial even in an acute case. Often we think this is an acute case, this is admission, I don't need to worry about some of those things that are going on in people's lives. Really important. Why? Because in the second half, a lot of your management is actually about logistics. How am I going to safely get this guy from here to hospital with all the information that he needs, with all the issues dealt with that are going on. So important things to understand: who's at home with the patient, what's their support system, who am I going to call when I need to send this person in, who do you want me to ring to meet you at the hospital, who should I let know that you're in this difficult situation right now. Things like work, often it's things like going back to work that prevents people from going into hospital in the first place. They don't want to go because they've got to go to work, and if you don't know what their work is, you're going to ask at that point, oh sorry, what is it that you do for a job? It doesn't look good when you're working things out in the second half. So yes, psychosocial might not seem as important in an acute case as in other cases, but actually it's really important to understand those things because they're going to come as part of logistics. Things like, do you drive? You don't want to find that out in the second half when you're about to admit someone who's had a seizure, or you're about to admit someone who's had a TIA, for example. You want to know early on that they drive so that you can bring that back yourself. Now, you mentioned that you drove earlier on. Unfortunately, I think we have to work out another way to get you to hospital today. Again, don't find out in the second half when the patient goes, oh doctor, so am I okay to drive then to hospital? Oh no, sorry, you can't drive. I didn't realize you drove. And it gets very confusing, you get very flustered, and it becomes a little bit difficult to manage. So psychosocial is a really, really important part of acute management cases. Think about who's around them, who am I going to call? Think about what they do for a job, just in case that's important. Think about whether they've got kids, who's going to pick the kids up from school? Why about that prevent them from going into hospital? Think about things like driving, really important. Don't forget the psychosocial, because logistics is such an important part of management. It's not just, do you admit the patient or not? Thirdly, when you come to management, if you know this is an acute admission case, think about what is the most important line I've got to say in this second half. It's probably going to be the words hospital today. Now what we often do is we leave the words hospital today until minute 9:30, minute 9:45. And to be honest, the case might only really get going when you say the words hospital today. It's very nice telling the patient that this could be really serious. It's very nice telling the patient there could be complications here. It's very nice telling the patient that, I'm a little bit worried here. But if you don't say the most important line in the case, hospital today, it's going to get longer and longer and longer and more prolonged and more prolonged and more prolonged. And things like logistics that we talked about earlier, you don't have a chance, because the patient only starts reacting to the word hospital today late on in the case, and where does logistics fit in? It doesn't even reach that point. So what we talk about is getting the words hospital today in as early as you can, preferably around the kind of diagnosis time, because you don't want to give the patients too many bombshells to deal with. Yes, you tell the guy, gosh, I think I'm a little bit worried here because I think this might be coming from your heart. I think you might have a bit of a heart attack going on. Now, if you pause there, the reaction begins. Heart attack, oh my God, am I gonna die from this? I had no idea it could be this. Are you sure, doctor? It gets really, really difficult. Time starts to lag. You start to get stressed because you haven't done the most important thing of the case yet, which is admit the patient. Sometimes when the patient then will calm down, you will then hit them with that second line. Oh, and actually, I think what we need to do here is send you into hospital. Bang, second bombshell, second reaction. What? Hospital today? I can't, doctor, I've got work, like we talked about, I've got kids to pick up. I can't go in today. Why today? Suddenly you're stuck with two reactions. So sometimes it's worth bringing that hospital today line, if you can, if it's appropriate, alongside the diagnosis. Yeah, Mrs. Smith, I'm a little bit worried actually. Now, I know you talked about muscle pain. Look, it might be muscle pain at the end of the day, but actually looking at it the way things are, I'm a little bit worried here. I think we actually might be dealing with something a little bit more serious here, something that might be to do with the heart. Now, I'm going to be honest, what we tend to do in this situation is actually think about getting people into hospital on the same day to get this looked at in a bit more detail. Bang! So you said the most important line in the case very early on. The patient can now start their reaction not only to the word heart, but also to the words hospital today, and it gets things moving a little bit quicker. People sometimes say, well, this is breaking bad news. Aren't you supposed to slowly walk the patient into that? Yeah, that's absolutely right in breaking bad news. But actually what you're dealing with here is acute management. It's not breaking bad news, it's about getting things done. So bringing that word in early on can sometimes help a little bit. Don't delay it until minute 9:45. You've only just started managing that situation at that point. And finally, guys, one of the things that I suggest is to anticipate resistance to admission early on. Now, you might get a case where it goes really smoothly. You tell the patient what's going on, you suggest things like going to hospital, they agree, and you sort it all out. Fantastic. But often you're going to get some kind of resistance to going into hospital. That could be due to logistics, like we talked about. There's things that need to be sorted out, kids to collect, what to do about work, for example. That's okay, you can sort those out through logistics. But what if the patient just doesn't want to go into hospital? You're going to get some cases where they don't want to go in for various reasons. Now, at that point, it's really important that they understand what the ultimate risk is if they don't go into hospital. Until someone understands what the ultimate risk of them not going into hospital is, really the decision not to go in is invalid because they haven't made the decision with the full amount of information beforehand. So if you get a case where, for example, you really think someone needs to go to hospital, rather than spending 2-3 minutes telling them, I think it's really serious, I really think you should go in, I really think on this occasion you should take the advice, rather than doing a lot of that and still getting resistance, it's about thinking, right, I need to get to ultimate risk quite quickly. So for example, Mr. Smith, look, I don't want to worry you here, but the reason that we like to get people into hospital so quickly with something like this is that if we don't treat it quick enough, then potentially it can be a life-threatening condition. Now, it's very unlikely at that stage that people are still going to go, actually, doctor, I'll be all right, I'll go tomorrow. A lot of times they're going to say, right, God, I can die from this. Okay, gosh, I didn't realize it was that bad. Maybe let's go in. What should I do? How do I get there? And it can get things moving. Now, if still they say, right, well, actually, doctor, you know what? I get that I can die, but actually, I'm okay. I don't want to go. I'm not going in today. Then at least you've given them ultimate risk, and then you can think about, well, what's the next best thing that we can do, like an urgent appointment, or sort of review the next day, or something like that. But until you've said that ultimate risk line, you can't be confident that they've made the decision correctly. So anticipate resistance. It's coming. If it comes, don't spend 3 or 4 minutes until you get to the ultimate risk line and say it at minute 9:45, because again, you haven't got time for logistics if they change their mind. So get it in quite quickly, and potentially life-threatening does the job for you. Avoid the word death, avoid the word die, avoid the word fatal, these things that hit people quite hard. Potentially life-threatening does the job, but doesn't hit them so hard, and it allows you to move the case forward one way or the other. So guys, I hope you found some value in that video. Just remember there's 4 key things about admission cases. Number 1, get those cues early. Make sure your mindset is set in admission mode, acute phase mode, early on in the case. Don't leave it too long. Secondly, don't forget psychosocial. We often neglect it, but actually psychosocial plays a huge part in logistics of management, and management's not just about do you get them to hospital or not. Thirdly, it's all about using the words hospital today as early as you can. Don't leave it till minute 9:45, because sometimes the case really gets going when you put those lines in. And finally, anticipate resistance, and not only anticipate it, know how to deal with it. Think about ultimate risk, think about potentially life-threatening, just to get things moving in some cases. So again, as you can see, admission cases are slightly different to your normal standard cases, and you want to get things moving quickly, and you want to take advantage of some of these things in your practice. Now, if there are other videos that you want me to create, both for ACUTE or CSA, please let me know. We try and get a video or two out per month because we want to get you focused and keep your preparation going along the right track. If you found it useful and you want to see some of our other videos, please check them out. Please subscribe to the channel if you think they are of value to you. Hopefully we'll get to meet some of you guys at our courses or mocks going forward. But if you are taking the exam in the next couple of weeks, good luck. I'm sure it'll be great. Any queries, just give me a shout.